Shalom. Welcome to the New Indian Express. I'm Anusha Ravi Sood. Very glad you could join us on this week's episode of TNI Talk Room. Data released by the Union Health Ministry on Friday showed that the Delta variant of COVID-19 was present in about 52 districts across the country in March, but had spread to 174 districts by June. Delta Plus variant has been detected in about 48 samples in 10 states so far, including Karnataka. On this week's TNI Talk Room, we discuss this new variant that the government has flagged as a variant of concern. And to take us through the details of what this variant means, whether one should be worried or panic over it, but most importantly, are vaccines effective against this new variant? We are joined in by Dr. V Ravi. He's the Nodal Officer for Genomic Information in Karnataka and also the Chairman of COVID-19 Genomic Surveillance Committee. Talk is going on about Delta variant, now the Delta Plus variant as well. And to give us a detailed description of whether this is a matter of concern, what is the way forward, on TNI Talk Room, we are joined in by Dr. Ravi. He heads Karnataka's team for genome surveillance, and he's also the Nodal Officer for Genomic Information in Karnataka. Doctor, thank you so much for joining us on this week's TNI Talk Room. First things first, should we be worried about this new variant, Delta Plus of COVID-19?
Thank you, Anusha, for having me on the show. And let me tell you, should we be worried? The answer is yes. Should we be concerned or should we panic? The answer is no. Delta Plus is a variant that has been described a couple of weeks ago. And it belongs to the Delta lineage. So whatever Delta is doing, we should expect Delta Plus to do, which means it is Delta itself is more infectious than alpha, beta, or gamma. So we should assume that it is as infectious as Delta itself, the Delta Plus variant. Variants will keep emerging. That is the norm, and there is no way we can prevent variants from emerging, primarily because the virus is endowed with a property of making mistakes when it replicates. The enzyme RNA polymerase, which copies virus genetic material, makes mistakes. And when these mistakes accumulate in certain critical areas, then it can change the structure of the virus, thereby making it a better fit into the human cells. So this is ongoing. One cannot prevent it. The second reason why variants emerge is our own defense system puts pressure on the virus. Suppose we get infected or vaccinated, we build a very, very aggressive response against the spike protein. The viruses change their structure to escape the immune system, which we call it immune escape variants. So we will continue to get variants in future. Coming back to Delta Plus, the only difference between Delta and Delta Plus is that there is one additional change in one of the amino acids at position 417 from K to N in Delta Plus. So this, what we know as of now is it more infectious? Data is still emerging. Let me come to our own country. We have reported close to 50 now. If I'm not mistaken, 48 Delta Plus cases and from many states, and at least 12 countries in the world have reported Delta Plus. The Delta Plus reported in our country are of samples that were collected in late April and May, which means almost 4 weeks ago. So had it been very, very infectious, one would have expected much more number of cases to have occurred in the community. I'm not saying it is not infectious. I'm just telling that this is some good news and some reassurance that had it been very infectious and very dangerous, so to say, we should have seen more severe cases, more deaths, and more number of cases reported, especially when the second wave is subsiding. However, we need good contact tracing. All the Delta plus positive patients currently states have been advised to do aggressive contact tracing. Many states are doing it. I know Karnataka is doing it very well. When that data emerges, how many of them are positive? If they are positive, their genome sequence, is it Delta plus? These are things that will unfold in the next week to 10 days. Until then, we should assume that it is as infectious as Delta and go about taking appropriate precautions.
Now that covers the infectious nature of this variant. You also spoke about how Delta Plus is different from Delta because of the specific mutation that has taken place, specific mutation in this particular variant. Now there are concerns being raised about this particular mutation as well, also considering its similarity to the beta variant of COVID-19, that it could be resistant to the medication, the treatment that we are currently giving, also the probability of it being resistant to the vaccines. So there are concerns around the same. Could you throw a little bit of light on the same?
Yeah, it's a very important question that you asked. Yes, the mutation that is noted in Delta plus is very similar to what is found in beta virus at the same position. Beta virus earlier was called the South African variant. Now, does this pose any challenge? What information we have now is one of the therapies that has been used in COVID, not extensively, but in some patients, because the therapy is very costly, and that is giving a cocktail of monoclonal antibodies. Now, this cocktail of monoclonal antibodies are directed against one particular portion of the spike protein known as receptor binding domain. And since this mutation is sitting in that particular area, people have found that the cocktail is not working. This is a report from UK that the cocktail is not working in people with Delta plus. I'm not extremely worried about that because that is not the main mode of treatment in COVID-19. It's extraordinarily expensive. It's a couple of lakhs to give a cocktail of monoclonal antibody. The second part of your question was, is it going to escape vaccines? Is that going to be a concern? Let me tell you, Delta itself is escaping vaccines. In that sense, people who are vaccinated are getting infected with Delta. But the good news is, all vaccines are able to protect against serious disease and death. So that's a silver lining. With that silver lining, because it is a sublineage within Delta, I presume it will give protection against serious infection and death. But no vaccine can prevent infection. Now, there are studies both in UK, in fact, some preliminary evidence has come from UK that they have taken the blood samples of people who are vaccinated and in the lab tried to neutralize it with Delta plus, and it is getting neutralized. Indian Council of Medical Research and National Institute of Virology have started the studies. Within a week, we will have that information. I also believe from what we have so far evidence that it will be neutralized. May not be to the same extent, same degree as, but certainly if it neutralizes partly also, it is going to protect against severe disease. So that's my opinion on this.
Oh, that's brilliant. That is actually a silver lining, as you mentioned. Any kind of any kind of stopping of serious infections, severity of infections, and death is always very welcome. My last question to you: now that in Maharashtra we see that the state government has decided that it is not going to provide any more relaxations until it sees a substantial drop in the number of cases, especially with Delta plus also being a matter of concern for the government. In Karnataka, the chief minister has said it's not something that we need to panic about or greatly be concerned about. But limited to Karnataka, now that we have a couple of cases of Delta plus also, are there things that we should be doing differently? What measures should we be taking? Most importantly, should there be, a little bit of slowdown on relaxations when it comes to lockdown guidelines?
Generally speaking, yes, lockdown should not be hastened. They should be graded. And for that, we should be guided by the test positivity rate, not at the state level, but at each district. Remember, every state in India is one country in terms of size of population. It beats many countries. There's nothing called one size fits all. So locally, every district, that's what we have already advised, and it's already being taken up. Teams are looking at every day's test positivity rate, looking at 7-day moving averages. That should guide unlockdown pace and strategy. Should be adopted based on that. So anyway, Karnataka has said that till 5th July, they are in the second phase in districts, about 19 districts that have shown less than 5%. For districts between 5 to 10%, they're still imposing restrictions. And of course, Mysore is still under lockdown. As far as Delta Plus goes, do we need to take any other precautions? I think there are a couple of things that all state governments are doing, that all inward coming people from other states are being subjected to test. It helps, but it will not, you can't seal down borders. And also, if I am infected and I'm negative because I'm in the second or third day traveling, I can come into a state and then manifest disease. So it is good to have some kind of checks at borders, but that is not going to prevent virus entry. You see, virus will always find. Virus don't have geographical borders. Human beings have. So I would say that two things have to be done. One, we need to continue to emphasize on the importance of COVID appropriate behavior, masking, avoiding crowds, mostly closed spaces. And I know it is very difficult. It's easy for me to say everybody should wear masks. Having worked in NIMHANS, I can tell you that behaviors are the most difficult to modify. We know more about the virus and the disease than about human behavior. And that's why this second most important thing is to accelerate vaccination. Given all the challenges in terms of availability and distribution and getting it across to people, but still that remains the most practical way of protecting people. And the preliminary evidence also from UK has already shown that vaccines work even against Delta Plus. So I think these are the two things. But variant or no variant, any future variant that will come, I'm not an astrologer, but I can tell you that no variant has more attributes to penetrate a mask. Thank God we don't have a variant that goes through masks. So I would emphasize that people should be very responsible and remember that my protection is my responsibility. It's not anybody else's responsibility.
Absolutely, doctor. Thank you so much for reiterating that most things that people can do right now is in their hands. Wear a mask, ensure social distancing. Now is not the time to let our guards down. Also, my biggest takeaway from from this interaction is that there will be mutations. Probably there will probably be more variants that will be deemed as variant of concern later. But at the end of it, vaccines are the way forward. So any kind of mutation should not be deterring us from going and getting vaccinated. Thank you so much, Dr. Ravi, for taking out time to join us on this week's TNI Talk Room. I'm sure your insights will help a lot of our viewers, our readers in understanding this variant. Thank you so much.
Thank you.